Hello everyone, welcome to BrainMindia. In today's video, we are going to discuss about anxiety neurosis. And for that purpose, we have in our studio a famous doctor, Dr. Jakir Hossain Laskar. Welcome to our studio, doctor.
Thank you.
My first question will be, what is anxiety neurosis?
Yes. Nowadays, it is prevalent that people in various walks of life, they have been suffering in stress, various types of stress, tension, anxiety, and depression as well. So, this is something different, anxiety neurosis. This is a psychiatric disease, a mental health condition, and it is in another way called generalized anxiety disorder, which is called in short GAD, G-A-D. And patient experience uncontrollable worry and anxiety about various aspects of their life.
Okay.
Especially, they understand that they are having some kind of disproportionate situations with actual situation, and which is why it interferes the actual functioning of their life.
Okay.
Eventually triggers the anxiety.
So
this is all about anxiety neurosis. Yes.
So, what are the symptoms of this disease?
Yes. When patients come to our clinic, they, as a keynote symptom, red line symptom, they express excessive worry. They say that persistent and excessive worry about various things, such as regarding their work or workplace, regarding their health issues, regarding social interactions, regarding their finance. These kind of problems they experience, they are having serious worry.
That's right.
In those respects. And secondly, they say they are having restless. They are feeling restless, mental fatigue, they are feeling irritability, they are having difficulty concentrating issues, agitation, irritability are common. And finally, they say that they are having sleep disturbances. Insomnia is evident in all kinds of anxiety neurosis. So, these are the common symptoms of insomnia.
And what are the causes of that disease?
These causes. Genetic predisposition is one of the main causes.
Okay.
Because if the predecessors of any family had experienced anxiety neurosis, the successors of that family may suffer anxiety neurosis. Brain neurochemistry changes is one of the important causes. The imbalance between serotonin and dopamine causes anxiety neurosis. Because of some personality deviation, changes in personality can trigger anxiety neurosis. Some life experiences may trigger anxiety neurosis. Some people just understand that some people has gone into stressful events, traumatic situations in their previous lives. So because of that, they experience anxiety neurosis. And some extreme medical conditions, those who are suffering in critical diseases, life-threatening diseases, they feel that how long they will survive. So which is why they express anxiety, severe anxiety and restlessness, irritability, all those things. These are the common causes of anxiety neurosis.
But how can we treat it? Is there any treatment, or what should we do?
Actually, before coming to the homeopathic treatment, but obviously in homeopathy there is a great scope of complete cure for anxiety neurosis. But there are great scope in management without medicine.
Okay.
I can say that you have already known, I understand, that cognitive behavior therapy, commonly known as CBT, is very efficacious in treating anxiety neurosis, in managing anxiety neurosis. Efficient therapists try to identify the negative thought patterns and behaviors of the patient, and they act accordingly through mindfulness meditations, through relaxation techniques, through breathing exercise, through progressive muscle relaxations, and using some guided imageries. But along with, if patient do physical exercises regularly, then within a short span of time, they may experience improvement in anxiety neurosis.
Okay.
Okay, and besides, lifestyle has to be properly modified, because they have to have a balanced diet, proper regular sleep, and they have to avoid caffeine or alcohol or cigarette, all these things. And yes, one thing, besides cognitive behavior therapy, there are other kind of psychotherapies which are also efficacious. One is important, that is called exposure therapy,
Okay.
which is very important. We when patients come to us, we give medicines. Besides, we insist them to go to the clinical psychologists who are expert in exposure therapy. One more important therapy is biofeedback therapy. These two therapies are very efficacious in managing anxiety neurosis along with medications.
So psychologists can play
A great role in treating anxiety neurosis. Yes, and I can say in this regard that 80% of the anxiety neurosis patients can be well managed through psychotherapy and counseling. No medications will be required. Only 20 to 25% of the patients of the total population are required medication.
And what about that 20%?
20%, yes. Homeopathy has great scope. Unlike other diseases, it takes only 3 to 4 months to cure the disease, and it is completely curable if it is taken along with therapies. For the guidance of our beloved doctors, I will tell some medicines which I use in my practice. Argentum nitricum, it is a great polycrest medicine for managing anxiety neurosis. 10 potency of Argentum metallicum, if taken once a week for 2 months, anxiety neurosis can be managed completely. And besides, sometimes phosphorus 200 is also required to manage the acute condition of the patient. Sometimes some obstinate patient, chronic patients, the condition is being relapsed every after 6 months or every after 4 months. Ignitia mother tincture can be used 10 drops twice a day with little water for 1 month. If it is taken, a patient will never experience relapsation in this regard. Along with calcarea carb, this is a biochemic salt, 6x potency of calcarea carb. If it is taken 4 tablets twice a day for 1 month, the acute condition of all kinds of symptoms regarding anxiety neurosis will be relieved, and within 3 to 4 months, the total important symptoms will be alleviated.
Well, we have learned how to treat the disease, anxiety neurosis, but before ending the video, I would request all of you that please do not go for self-medication. Self-medication is always dangerous. So before taking any kind of medicine, please consult expert doctors and then go for medication. Well, that's all about anxiety neurosis. I hope you have learned a lot of things about anxiety neurosis and how to treat the disease. That's all for now. Take good care of yourselves. See you in the next discussion.